COVID-19 session. Let me introduce this session. All of the presentations refer to 6 different chapters in the current Handbook of Labor, Human Resource and Population Economics, which is edited by Klaus Zimmermann, who is here in the session. And I am proud to be the section editor of the COVID-19 and the Handbook, and I'm super happy to have been able to organize this amazing session. First, I would like to thank Klaus for asking me to organize the session and for the continued support in the organization. Thank you to all of the organizational committee of the EBES for hosting this session. And obviously, thank you to all of you for accepting our invitation to present the main results of your service. We are going to discuss 6 different aspects of the COVID-19 consequences in the labor market. All the presentation and the chapters contain a complete review of the very recent and current increase in literature of this aspect of the COVID-19. The order of the presentation is the following. We have just one change in the order. The first one is COVID-19 and Gender by Marcella Corsi. The second one is COVID-19 Vaccines, Innovation and Intellectual Property Rights by Guido Cozzi. The third one is The Effects of COVID-19 on Co-working Space by Ilaria Mariotti and co-authors. The fourth one is COVID-19 and Working from Home by Bill Kosteas and Francesco Renna. The fifth is COVID-19 and Technology by Mauro Caselli and Andrea Fracasso. And the final one is on COVID-19 and Environment by Leonardo Becchetti, Tom Palmer, and Francesco Solis. I think we have, let's say, 15 minutes for each presentation and 5-6 minutes for discussion, comments, and whatever. I think we can start. Marcella Corsi is full professor at the University of Sapienza, Rome. And I think, Marcella, the floor is yours. I think you can share your presentation.
Yes, Sergio, I'm doing it.
Right.
Yeah.
Yes.
Can you see my screen now?
Yes, that's perfect.
Great. So here we are. Thank you so much for the invitation. It's really a pleasure to be here with you today. I'm going to present this chapter that I suppose, as all chapters in the Handbook, had as its main aim to present, to collect, to somehow even organize a broad literature concerning the topic chosen, of course, by each of us, and of course harmonized in the context of the full design of the Handbook. As far as we are concerned, so I speak also for my co-author, Ipek Ilkkaracan from the Istanbul Technical University. What we have been asked to do and what we did with pleasure is to organize and present then to you even today quite a large literature concerning the impact of COVID-19 as a syndemic from a gender perspective. But of course, we had to concentrate attention just on specific aspects, because otherwise we couldn't really manage to summarize all the discussion in the few pages that were allowed to be used. And so we decided to concentrate our attention on labor more specifically, so on the impact of the syndemic on the labor aspects of our economy and our society. Obviously, when we speak about labor, or at least I hope, obviously, we have to distinguish quite clearly between unpaid work and vice versa, the labor that is remunerated in the labor market. So talking about the employment impact of COVID-19. I say, of course, because for us, for Ipek and I, we are both feminist economists. As a matter of fact, at the moment, Ipek is the president of the International Association of Feminist Economics. The distinction between unpaid and paid work is crucial, also as a different paradigm in analyzing not only the impact of COVID-19, but generally speaking, the labor market trends and dynamics. So that's why, as you can see from my slide, the summary of our chapter is really split into two different parts. The first one concerns the gender economic impact of COVID-19 on unpaid work. We kept on using the word pandemic, but as a matter of fact, we agree, both of us, agree that we should have used the term endemic. Anyway, and the second part, vice versa, refers to the gender economic impact on employment and labor markets. And within the first part, of course, I don't have the time to show you all the results that we have summarized in our chapter, but I will concentrate just on some key points. But really, very quickly, just to give you a proper idea of what you can find in a chapter like ours. First of all, in the first part, we have analyzed the impact of COVID-19 on the living condition of working parents. Then we have analyzed in detail the impact of school closures, especially in terms of the increasing of unpaid work within households. Then we have analyzed the increased burden of care for elderly and disabled women. And then finally, we had a global look at the deterioration in work-life balance due to the effect of several factors. Some have been already mentioned, for example, the school closures, but last but not least, is quite relevant, the impact of working from home experiences accumulated throughout the pandemic and in different countries. Concerning instead the impact on employment and labor markets, we had a special look on the so-called essential workers. Most of them, by the way, are once again women. Then we had a look at the employment loss and the economic vulnerability brought by the COVID-19 crisis. We had a quick look at the intersecting inequalities, taking into account that gender is not just a binary concept, men and women, but instead is a multidimensional concept that implies to look at social classes, race, age, and so on. So in that sense, we speak about intersectionality. And then we looked at the implication, as I mentioned also before, of working from home on gender inequalities in the labor market. And finally, we had we made some reflections, and I will also close my presentation today talking about flexible work schedules. This is the whole structure of the chapter. I hope you will have the time and the pleasure to read it. In any case, few key points in the time that I have today. So certainly, I think this is something that we all agree about. The COVID-19 pandemic has caused a global health crisis, certainly a global economic crisis, and the risk of this crisis is to deepen existing inequalities along several dimensions, including gender, and as I said, gender in a multidimensional perspective. So there is indeed a serious risk from the gender equality viewpoint of rolling back decades of gains achieved in the labor market, especially in terms of participation. And And this is certainly one of the main risks stressed, for example, in Europe, even by important supranational institutions. So first of all, of course, the European Commission, since in the national, in the RRF, so in the resilience and recovery facilities, has been stressed quite clearly that gender had a very important part in addressing the impact of the crisis and in finding, of course, a way out of it. This means, first of all, to look at the impact of the pandemic in terms of loss of employment. This is something, as I said before, that we address specifically in the chapter. And this loss of employment that was quite clear since the beginning of the crisis, when we start collecting data concerning the loss of jobs caused by the crisis, was caused was referring mostly to female employees, and this was because of the effect of the loss of employment in specific female-dominated in terms of occupation sectors, like the one strictly related, for example, to the care activities. But this is something that I will show you also in the next slides. Certainly, there was less impact. There was a minor impact instead in sectors, for example, related to male-dominated employment. This, for example, is the ICT sector. And by the way, even in the recovery measures taken in many countries in Europe for finding new occasions of employment, and also in terms of fiscal incentives, the sectors that have been incentivized are very often male-dominated sectors, once for all, construction. So, having said that, another point that we probably would agree, all of us, is that there was during the COVID-19 crisis an increase in demand for care work. But this increase in demand has somehow been triggered by higher need for healthcare, with definitely quite a lot of criticalities in terms of the healthcare sector, also in terms of supply of labor. But at the same time, we have seen a negative effect of lockdown measures in terms of public provisioning of services and market substitutes for household production. So this is something that we have experienced directly, all of us, due to the lockdown measures that have not allowed us to have the services that we might have needed. The most critical, of course, problems arise on the medical side, especially, for example, for oncological patients. But within the household, because anyway, this is quite important for us, especially when we want to concentrate on unpaid work. Within the household, the disproportionate gender division of labor caused quite a higher burden for women in terms of unpaid care work, especially during the lockdown condition. When we speak about unpaid care work, this has also been measured by specific surveys in different countries. We specify, of course, the sources of information. Also in the chapter, we try to present the most reliable data in that sense. I say the most reliable data because in most of the cases, this data have been collected through online surveys, for example, because it was impossible to go around and interview people, of course, on the street or going around or visiting people in the house because of the lockdowns. So online surveys, of course, have been extremely relevant as a source of information, but not necessarily extremely significant from a statistical point of view. So we had to take somehow to make a selection of the data that we could collect in that sense. But anyway, As a matter of fact, most of this data show this overburden of care work for women, especially during the lockdown. And this overburden is not just for taking care of children, or not just for taking care of elderly people, but generally speaking, for taking care, for example, of the household in terms of domestic work. And this is something, of course, that cause specific or rise specific questions about the need of a real change of the intra-household division of labor. Then the issue of telework, or as we said, working from home practices. This is indeed something completely new for all of us, at least in the diffusion that this type of organizational work has achieved through because of the pandemic and due to the lockdowns. This is a new challenge also in terms of understanding the impact of this type of organization on our life and on our issues, more specifically in terms of the impact on gender equality. As a matter of fact, the impact is still not totally clear, but what is clear is that technology is not enough. Technology is not enough in a sense that technology certainly helps, especially employers, to apply this type of organization, but not necessarily all households, and within the households, all members of the households are equal in terms of access to the technology, and therefore also to manage their time or use their time according to technology. So in that sense, flex time is extremely important as a way out of this type of new slavery that came into play with the telework. And this is something that concerns us also for the near future, but I will come back to this point in a second. As a matter of fact, flexible work schedules have been supported by employers, but very much used in a way that is not necessarily appropriate. We know that there has been a misuse of flexible work in the sense of increasing the time schedule to organize work time outside of the contractual objectives and rights, and it has become more and more difficult to separate work and private life in general, not only for women, but in general. But certainly this has been particularly difficult for women, and among women, for mothers. And this is something, of course, that we present in the chapter, taking into account several papers that have been dedicated to this issue that, of course, refers to the reconciliation of work and life, but also issue that refers to the traditional division of caregiving task within the family. Finally, this is my last slide. I hope I'm still in time, but I'm going to close quite soon. I just said before that, for example, telework, or generally speaking, working from home activities or organizational labor is a challenge looking at the recent times and trying to understand the impact of COVID-19 in recent times, but it's also a challenge for understanding what is expecting or what we could expect in the near future in a gender perspective, and generally speaking in terms of challenges referring to the work-life balance for all men and women, mothers and fathers. So what is sure, because we have enough evidence already about that, is that companies, employers, as I said also before, are rapidly introducing flexible work arrangements, but mostly at their advantage. As I said before, asking people to work in the night, asking people to react by telephone at any time during not only during the working week, but even on weekends and so on. And this is, of course, something that people in need of work, people that might risk to lose their job. And this is, of course, the most fragile part of employment. And of course, by the way, this most fragile part of employment is very often made by young people and women, or migrants, of course, have certainly lost some of their rights that, of course, must go back to them. And in that sense, also the social dialogue is very important, and the role of trade unions should be stressed as important players in this perspective. For example, in Italy, there is already a large debate about the right of disconnection, but not all trade unions, for example, are totally involved in this type of debate, just to give you an idea. But anyway, so this is the first issue also concerning the future. The second issue refers, as I said before, to the intra-household division of labor, or what we could call also sexual division of labor between men and women, especially among parents, so between women, between mothers and fathers. As a matter of fact, especially in the first lockdown, this is something that we have observed also in Italy with a specific online survey that we carried out at my laboratory. I'm the coordinator of Minerva Laboratory on Diversity and Gender Inequality of Sapienza University of Rome in the context of the Department of Statistics. So we ran out an online survey in the first lockdown, and for example, but we were not the only one to notice this, there was an increasing role of fathers with some satisfaction in the role in being involved in care activities, especially with young children. This was certainly a positive sign. That's something that we definitely need to take into account. But this cannot be just considered a spontaneous effect, or at least we cannot just rely on the fact that this type of attitude might become a constant within the intra-household division of labor. That's why we are strongly in need of political measures that might not only incentivize, but made this attitude a reality also from an institutional point of view. So that's why we strongly believe, Ipek and I, that it would be necessary to create a more balanced division of labor within the household, to introduce parental leave or paternity leave that might be not just voluntary, but compulsory for all fathers and for at least 3 months. Having to say that mothers and fathers should have the same rights, but should have also the same duties, and also implying that these duties would be fully paid with public resources, so entering into the public, into the social spending. Finally, definitely we believe that the COVID-19, also thanks to the literature that has been produced throughout these last 2 years, might be an occasion to have a full reflection, a full discussion, not only in economics, but generally speaking in the society, about the current gender gaps, but also in terms of the expectations and pressures on women. And do not forget that we are not, no human being, and not certainly women, are just made for work, but are also made for leisure. And in that sense, we would like to have the possibility for all of us to be free to choose and happy. To know more, of course, this is the link to our chapter, and we are ready to discuss. Thank you so much.
Thank you so much for your very nice presentation, Marcella. Do you have any comments to Marcella?
May I close my presentation in
Klaus.
the meantime, or do you want me to leave it?
Yes, it's up to you. Klaus, please.
Just a short point. What is interesting in the COVID-19 situation that if for many households this was somehow a forced stay at home. So it would be nice, and I'm asking you as the expert in the literature, have you looked at this, so to speak, in a sufficient way, comparing the change in the role behavior between, let's say, those households where both partners were previously working but now had both to stay at home, and other situations like where only one or both still were working or had to work in the market? Is there some kind of, that we would see whether the pressure of, well, the excuse of one of the partners not to work at home is much weaker when you cannot argue, I have to be in the market and work there. Do you have any insights here?
Well, Klaus, as I said, most of the information that we have also summarized in our chapter were coming from online surveys, because as a matter of fact, not even statistical offices could produce good surveys during lockdown. So, for example, in Italy, we have a precious survey carried out by Istat, by our National Statistical Office, concerning the impact of COVID. But, for example, no report was published out of those surveys in terms of time use. We are waiting for that. Personally, I also asked Istat to have access to the microdata, but for the moment is not possible. Just to say that we are too close in terms of timing to what happened to know really well in terms of microdata, because basically you are referring to microdata at this stage, and we don't have proper microdata to discuss about that. Certainly, for example, in our online survey, the one carried out by Minerva Lab, we asked what was the situation in terms of employment before the COVID, and what was the situation at the time of the survey. And in some cases, of course, there was a change in the situation, in the sense that, for example, people had lost their job. This is something that happened very, very often, especially for women working in the retail sector, for example, or working in restaurants, or working in the tourist sector. No, I'm saying women because usually are women behind working as a cashier in a restaurant, or working as housekeeper in an hotel. I mean, we are quite, and mostly of them, for example, might be migrant. That is another issue in terms of gender. So we had this type of possibility of comparing before and after, but I wouldn't say that it's so reliable, the information that we get. For sure, since we are not totally out of the pandemic, for sure, if we have the possibility of repeating this type of survey, for example, in a few months' time, or even in 1 year time, then of course now the situation, as you know, is much more complex because of the new crisis that we are living in. So it's not an easy task, but I mean, certainly if we can repeat some of this observation in a more recent time, we might come out with some interesting point. But to be honest, I wouldn't rely completely on the information that we have until now. But of course, Sergio has worked on that as well as INAPP, and much better than we could. So maybe Sergio could answer to this issue more than me. I hope I answered to your question anyway.
Yes. We have a question from Leonardo, please.
Yes, just very short. Marcella, the other side of the moon, we know that the National Institute showed that the share of satisfied people satisfied with life raised by 1% in Italy during the COVID pandemic, and especially
and for fathers especially.
Yeah, and especially in the age between 30 and 50, and not, of course, people at school. So I guess that the work-life balance, at least, and you're right, there is a gender imbalance there, I'm sure of that, but at least for the middle-aged people, I'm quite curious. I believe that the U-shaped effect of age on life satisfaction has been in some sense affected by COVID, because people found themselves richer of life, richer of time, okay, and then the work-life balance effect could have been important. Also, we have phenomenon of south working, people going back to their hometown and working there and being happy of that. So a lot of young people now are asking to remain with distance work, or they are ready to quit their job, because they want that independence they conquered at that time.
Yes, indeed. This is the issue of the agile work. No, we call it like that usually, to make a difference between working from home and being agile in working. For sure, yes, this is a very important issue. But of course, there is a class dimension here in terms of gender. This is something that might and certainly is relevant for people, for example, that have a type of occupation like the one that we have. So we can work quite easily online, as we are doing now. We can work on the beach, like working on the mountain and so on. But this is not typical of everybody. And those vulnerable people that I mentioned before, the more fragile within the labor market, are certainly not in this situation. We are talking about people working in supermarkets. We are talking about people working as nurses in the hospitals. We are talking about, as I said before, cashiers or people working in the retail and the catering sector and so on. So indeed, I think there is a bias in those surveys due to the fact that only people working in certain conditions could answer also to those surveys. This is also for our survey. The one who managed to answer to our survey online using a computer were not certainly the category of people that I mentioned before. So in that sense, I really hope that either INAPP or ISTAT or other important statistical institute we have in Italy will soon be able to go around and interview people, not on the street, of course, in their own houses or in their works, in their offices, to know more about this. And I think we still have to discover quite a lot of issues, but sentiments are quite crucial in that sense. I totally agree about that.
Yes. Thank you so much. I think it's time to go to the second presentation because we are late. Second one is Guido Corsi, which is Guido is full professor at the University of St. Gallen in Switzerland. He is a former full professor in this university in La Sapienza, and most of all from my point of view,
professor at La Sapienza. I was associate professor. Then I became full professor in Macerata.
Oh, okay, that's good. But most of all, from my point of view, he is one of my supervisors in the PhD in economics.
Yes, because I was working both places.
Guido, the floor is yours.
Thanks a lot. Great seeing you guys, fortunately in person. Hi, Leonardo.
Hi, Guido.
So I will be talking about COVID vaccines, innovation, intellectual property rights, because I also think it's very important. I hope you can see my screen.
Yes.
I will try to be very fast because actually I don't know how many seconds I still have. Something that strikes, these are recent data, and is that the world seems to be split between part of it which is nearly well vaccinated and part of it which is not against COVID. And that allocation of vaccinated and not vaccinated is not random. Clearly, the poorer ones are not vaccinated. This is something not entirely new in the vaccine literature, which I survey also in the chapter, and we see that usually pharmaceutical industries don't regard the low-income countries or the lower middle-income countries as very attractive markets. So this is always an issue. Also, Michael Kramer has been working hard to find ways to provide that. So, but the result then is that while we are pretty okay even though our vaccines are not new anymore. It took very, very long to produce them, much longer than to invent them. Low-income countries seem to be the cradle of new variants. So for this reason, a lot of medical literature that I surveyed in the chapter think that COVID-19 is about to become endemic. Okay, so as also Marcella was hinting, this is constant. So an endemic infection means constantly present and mutating over time. This is excellent news for vaccine producers, because you keep your customers willing to buy new boosters, for example. So, but not so good for the world. And in fact, at least from the economic point of view, if we don't want to mention deaths and hospitalizations and other aspects, you know, from the economic point of view, this closing and opening, especially in lower income countries or in middle income countries, creates disruptions in the global value chain, global supply chain. As we have seen now, for example, is the turn of Shanghai, but it may was spread all over China and also in other countries. So this is contributing, of course, to inflation and to lost GDP and to all possible problems, including the gender issues that Marcella mentioned, because gender imbalance is usually aggravating with non-pharmaceutical interventions, meaning lockdowns and so on, and forced other stuff. But it's not that the males are doing better than before. It's just they are uniform. They are both, males and females, doing worse. But for women, it's much worse. There's been violence, overexploitation, and so on. So and for GDP losses, the failure to vaccinate half of the population in the low-income countries is very high. So now the suspect comes clear. For example, for those who have read the Forsling and Hersling paper, it's an industrial organization paper with an intertemporal model of the influenza. So it's before COVID, and they realized that it is the optimal behavior of a monopolist, taking into account an epidemiological model. And the idea is that monopolists would like to slow production a bit for several reasons. One, of course, is simply that bioreactors are expensive. You don't want to produce everything needed in 2-3 months and let the rest of the year unused, but rather you would like to produce in a full year or 1.5 year, but this way you keep also alive, the virus in a way that keeps the susceptibles scared enough to be willing to buy other vaccines and so on. So there is this problem. So it's the problem of the private sector that the global sector should fix. Okay, so several mechanisms, especially related to IPR, which was the title I had to investigate in something that I really like anyway. Several solutions have been proposed, some voluntary, some non-voluntary. Given time, I will focus on the most controversial one, but also the most famous, because Biden unexpectedly joined as the president, as the United States joined more than 100 countries wanting this patent waiver, and usually those countries don't get it. They want a patent waiver on several medicines related to COVID, including vaccines. Okay. Now the idea, or the good aspect of the patent waiver would be making vaccines available, being produced and shared, produced by many firms and shared globally. And the hope is, if production is fast, because time is the issue. Okay, if one slows down, like for influenza, if the pharmaceutical firms manage to slow down the production, the vaccination of the entire globe, then the virus would have changed. So the COVID would not be globally eradicated. Instead, by ramping up production and involving several more firms in the production, sharing the know-how and so on, we have a chance to eradicate this virus. As for other viruses, of course, much more famous in history. For example, take polio vaccine, which was by the inventor, he didn't want to patent it, so it was extremely useful for the almost eradication of polio. And also, of course, smallpox and other examples. Now, the patent waiver has been obviously attacked by the pharma industry, and I've been reading a lot of criticism on it, with much interest, because I like industrial organization, IPR models, and so on. So the most common criticism I found was that the patent waiver is unlikely to generate entry by additional producers. Okay, so we can temporarily suspend the patents, but no other firms will really want to produce this stuff. So nothing will change, okay, in terms of quantity and profits. Okay, so this is going to be useless. Second, regardless of entry, firms will expect more patent waivers in the future, and this will discourage R&D. Okay, the fear of another patent waiver in the future, maybe another pandemic comes, and so on. And third, the governments would have to spend too much in R&D subsidies to compensate innovation. So what I do, I take these arguments extremely seriously and write a simple model with a very low probability of successful imitation following a patent waiver and expectation of future patent waivers. And then I asked how much should the governments spend to re-incentivize innovation to the no patent waiver case. So I assume that with probability P following a patent waiver, there will be a competitive entry of producers. Otherwise, with probability 1 minus P, no entry takes place. Okay, so you can say that in expected terms, the production may stay the same with a lot of probability or increase. The same meaning M, monopolistic production, competitive. And also profits, may fall to the competitive or not. Okay, then I write a model of a patent race, but I don't have time. You can trust it's pretty general. I have a general function for the probability of innovation as a function of the industry R&D investment. The industry R&D investment is an equilibrium with free entry. So the most important conclusion is this equation that basically saying that the higher the value of being a monopolist, so the expected present discounted value of all profits per unit of R&D, which is spent, because notice that 1 minus S is the part, so S is the R&D subsidy rate. So 1 minus S is the part paid by the firm. So the higher equilibrium recession development. So the more profitable R&D, the more R&D will be invested. So if subsidies increase towards 1, this will tend to infinity. Okay. So with a patent waiver, the investors know that with some probability there will be entry, so the profits will collapse to the competitive value. But with 1 minus that probability, they will keep the monopolistic profits. I repeat the exercise. I allow for the subsidy rate to differ, the R&D subsidy rate to differ in case of unexpected waiver. So this is a post-waiver scenario. So there's been a waiver now, 2022. Then in 10 years' time, another big pandemic starts, and firms expect a new patent waiver to happen. Okay, so then maybe governments taking care of that should remodulate their their subsidy rate, their R&D subsidy rate, and then we get to a similar equation. And obviously, there will be less R&D if the subsidy rate doesn't change. So in 2032, okay, the subsidy rate cannot be the same as now. For example, now we paid nearly half of BioNTech and Pfizer's vaccine publicly, so 0.5. Maybe we should increase that. So then I tried to see what level of the subsidy rate renders R&D investment the same as if there was no waiver. Okay, and despite the generality of the functional forms, this is the only thing that matters, and one can solve analytically for the level of the patent after a waiver or expecting a waiver. You will see that it will be an increase over the no waiver subsidy, less than P, where P is the probability of successful imitation. Okay, so this is the number assumed to be low. So if how much should R&D subsidies increase to guarantee the same innovation as without the patent waiver? Let, for example, P be 1/10, because 1 in 10 commentators thinks that it would be impossible for South African firms or Indian firms to copy our fancy Pfizer, BioNTech, or whatever Moderna. So let's assume that the following entry, competitive entry profits are halved, and the realistic current subsidy rate result, the R&D subsidy should have to increase by 2.5% to guarantee no decline in R&D investment. Even if you assume that profits went to zero after competitive entry, then the increase would be 5%. Okay, so the very argument, so that P is low means that it is easy for governments to reinstate the incentives to do R&D. Okay, so a low probability of imitation is an argument in favor, not against the patent waiver, as many commentators argued. Instead, because nobody took the time actually to write their argument mathematically. It's incredible how many economists opened their mouths publicly about this stuff. Nobody tried a model. And in fact, actually, I had to start this model I've written. It's my model because there was no other model available. And modeling wise, it is so simple to show that, costs are not going to be high. So I think Biden was very right also because, it's something historical. The United States, usually they are one, they are the champion of innovation. They are the heralds of IPRs. So they really care about this stuff. So my point is, if the United States decided, because usually it's the poor countries who want to attack intellectual property rights, right? This time it was also the United States. So I thought if the United States do that, maybe there is a reason, but maybe they know that it's not so devastating for innovation, okay? As many Europe, and unfortunately also here in Switzerland, believed like a dogma, and actually our beloved David Sassoli, one of the last things he said talking about this stuff was, let's not be dogmatic about IPRs. Okay, so he was right. Biden was perfectly right. In my exercise, it's clear that there will not be that devastating effect on research and development following a waiver. Questions?
Thank you so much, Guido. Is there any comment? It's a very critical point. I think there is no comment. I think we can go to the third presentation.
Okay, thanks.
Because we are late. Thank you so much, Guido. Thank you very much.
Thank you for allowing me to present it.
Thank you to you. I'm sorry, Ilaria, could you please postpone your presentation as a forward? Thank you so much. Sorry. So the third presentation will be by Bill and Francesco from the U.S.
Well, good morning, afternoon, or evening, depending where you're joining from right now. Go ahead. I'm going to take the first part of this. So this chapter is co-authored between myself, Francesco, and Sergio. So Sergio, thank you for putting this session together. We focus on work from home, and in particular, what we've seen with the pandemic. We're going to start off. Oops. I'm going to start off here with looking at some definitions of work from home, okay? And then we're going to move on to, sorry, I'm having a little difficulty with my screen here. Can you all see my, the presentation okay? Everybody find that? Yeah.
Yes.
Okay.
Yes.
So.
You just have to move to presentation mode.
Yeah, I'm just having actually trouble with my my view right now, so just give it a second here. Let me share again. Okay. Okay. I'm going to start off looking at some definitions and make also the distinction, interesting one that we see between potential for work from home and actual experiences of work from home during the pandemic. One of the interesting things I find, I think, is what do we mean by work from home? And during the pandemic, the definition of work from home tended to be the complete work from home, right? The 100%. But I think that's evolving more towards this notion of also to include hybrid work, right? Various setups as opposed to complete work from home. And of course, the reason for that is that the big grand experiment in work from home was a response to the pandemic, right? It wasn't a response to changes in the demand for work from home and firms' desire to try to change the way that they did things. Now, of course, there's some discussion of whether these trends really reflected or accelerated underlying trends that have been going on for decades, but it's not quite clear, that it wasn't just a simple acceleration, it really was a radical shift. So start off talking about work from home capacity, right? And here we want to think about, so these are all different efforts to try to measure what is the potential, the extent of work from home that's feasible in a society. So set sort of an upper bound, in a sense, on what share of jobs can be done remotely. And here we're going to think about two dimensions in which we can categorize these indexes. Are we basing the index on a task-based approach, such as the ONET data from the United States Bureau of Labor Statistics? And I know INAPP has a version for Italian, right, for the Italian labor market, and other countries have their own. Or is it a perception-based index, right? Is it the perception of which jobs are work from home compatible? And the other important dimension is the measure in question binary or continuous, right? And the binary measures tend to focus on the notion of, is a job compatible with complete remote work, right? Or complete work from home, versus a continuous measure, which talks about the extent to which a job may be performed remotely, right? And of course, that distinction plays into the notion of, hybrid versus, fully work from home arrangements. I think probably the most well-known index is the Dingle and Niemann index, which uses data from the United States Bureau of Labor Statistics. The ONET data uses a broad index of a broad set of job characteristics, tasks, and creates a binary outcome. You have others like Montenovo et al. Who use ONET as well, but they use only 3 questions and they constructed a continuous index. You have Boeri who integrate ONET and INAPP data and also their own evaluations of whether jobs are work from home compatible. And then another couple of examples, Barbieri et al. Who use INAPP data and construct a continuous measure, 0 to 100. And then finally, just one that's a little different than the others. One example of a survey-based, Holgersen et al. Use Amazon's Mechanical Turk to put the question out there for different occupations and ask individuals out there who are then paid for their responses, can this type of job likely be performed from a home office? And what do we see? Some interesting patterns that come out. Of course, higher income countries tend to have a higher estimated work from home capacity. And a lot of that is due, of course, to the industry composition of, or the occupational, industrial and occupational composition of the labor force in that country. Another thing that stands out, though, is that if you look at those 2 dimensions along which we can categorize work from home or potential work from home indexes, is ones that that the binary index is going to tend in general to find a lower share of work from home compatibility because they tend to be looking at jobs that can be completely performed from home, not jobs that may be amenable to some kind of hybrid work from home arrangement. And the other is that indexes that are based on perception of work from home tend, not always, but tend to yield a higher rate of work from home compatibility. A couple of examples, if you look at the 2, even right in the same study, the Alipur et al. Estimates for Germany, their perception-based measure of work from home capacity is 56%, but their task-based measure is at 23%. And even there, it's a very different estimate from Dingle and Niemann's own estimate from Germany. So we can see that even for any given country, the index that we use, the approach that we use to measure work from home capacity can give very, very different estimates of this upper bound of what share of jobs may feasibly be performed remotely. And of course, you can see, again, lower income countries tend to have a much lower estimated share of work from home compatible jobs. Now, what did we see prior to the pandemic? Well, we see that work from home rates were very, very low. Here in the United States in the 80s, you had less than 1% of all workers working primarily from home. Not surprising, given the state of technology, especially in information and computer technology at the time. But even, by 2010, the share rises to 4.3%, but up to right before the pandemic, we were still in the single digits, right? We really didn't see widespread adoption. And so we can't say that this really was a technology issue, right? Because the technologies that we're using today existed, right? It's just that they weren't widely adopted. Now, those estimates are based on individuals answering at a point in time. Do you work from home or do you regularly? Taking a slightly longer horizon and seeing if individuals work from home at all at any given point in time over a few years yields slightly higher estimates. So for the US, that goes up to about 10% or so. And again, one of the other things to bear in mind is, the design of how we ask these questions matters, right? Do you ask individuals, do you work from home at all? Right? If we define it that way, then we're going to get much higher rates. If we say, do you work primarily from home, you'll get much lower rates of actual work from home. But even then, how you design that question matters, right? What do you mean primarily? Do we mean 3 days a week, or does it mean how many of them are working really 90% of the time or more from home? Now, I think what's interesting of some of the international comparisons, right? and what drives some of the differences in rates, in work from home rates that we see, say, the US and the Northern European countries, which we'll show on the next slide, tend to have much higher rates of actual work from home compared to others. Some of the things we can look at, of course, are differences in culture, right? In particular, corporate culture across countries. In Spain, according to one report, one study, only 13% of employers were keen to offer the possibility of working from home. Whereas in other studies shows that Swedish managers were much more inclined to let their employees work from home, right? So culture obviously matters. And as has already been mentioned by Marcella in the first presentation, access to technology, we know, is also a big important component. Certainly within countries, even within the United States, within Italy, within every country, you're going to see big differences in access to technology. And of course, you see very large differences in access to ICT across countries as well. So here, this is focusing just on European countries prior to the pandemic, so the middle of the previous decade, and we see very significant variation in rates of working from home. General pattern, mostly the countries with very high work from home rates tend to be the Northern European countries, right? Countries such as Italy, Greece tend to be lower on that scale. One interesting outlier here is Germany, right? Of course, that raises the question of how much of that is due to differences of corporate culture, how much of it is due to differences in industrial composition, right? We know Germany is a big manufacturing exporter, and those jobs are not at all, except for the office support roles, those jobs are not work from home compatible. Now, one interesting study shows that 57% of companies in Germany in the early 2010s would offer or would be happy to offer work from home, but only 12% of workers took advantage of that opportunity. So an important dimension to not lose sight of when we think of prior to the pandemic and moving forward as the pandemic moves into endemic phase is to ask how important is take-up rates, and will take-up rates be much higher now that workers have had more experience with working from home. During the pandemic, we obviously saw a very large jump. Here in the United States, we saw the share of workers, according to questions that were added to the CPS, the current population survey, over 1 in 3 workers were working from home simply because of COVID, right? And so that's not including workers who were already working from home prior to the pandemic. That share declined back in the fall in September to about 13%. If we combine that with other estimates of those who are already working from home, that puts it that slightly over half of the US workforce was working from home at least some of the time. Very big contrast with, there's one study out of Japan where those estimates, Japan's work from home rate went from 6 to only 17% in June of 2020. Very, very stark difference in the experiences during COVID. And 2 reasons that are pointed out by the authors of that study is that Japan had a very different approach. They had more of a soft lockdown approach, right? They didn't take as strong, and even in the United States, we didn't have as strict a lockdown as other countries, but they had a much softer approach to lockdowns, and also differences in corporate culture. Other estimates, Brazil and in Costa Rica, you see rates of working from home or starting to work from home that are really only barely into the double digits. And so a lot of variation globally in terms of these responses to the pandemic. Let's kind of glance over this table. If you have a chance to read the paper, you can see this. Just going a little bit, pointing back to what Marcella said, right? These we do see gender differences. Interestingly, what we see from the U.S. data is that women actually reported a higher rate of switching to work from home, but what's confounding that very likely is the fact that women were also much more likely to leave the labor force altogether, right? So women who didn't have the ability to work from home may have just left the workforce altogether. So a lot of caution in trying to interpret those. At this point, I will turn it over to Francesco.
Okay. Hi, everybody. So I am the living proof of the joy and pain of remote work. My internet decided not to work this morning. So I am here at the entryway of my apartment building. So you may see some people walking by behind me, but anyway, it is clear that this shift that Bill presented in the incidence of working from home is here to stay. Probably not in the same magnitude that we have seen it in 2020 and 2021, but it's not going to go away. So a natural question is, what are the social implications of this dramatic shift in the way we work? And an obvious starting point is to look at what is that doing, remote work, what is remote working doing to the gender wage gap, which I'm assuming was also touched by Marcella, but unfortunately, I could not log in. So I do apologize for missing that presentation, which probably would have been very interesting. So there are two possible ways that working from home can affect the gender wage gap. On one side, we have somebody coming right now. On one side, we have that because women tend to work more on service sectors, which require face-to-face, then interaction, then it's possible that they may not benefit from working from home. And so this shift to more working from home modality of working can actually penalize and enlarge the already existing gender wage gap. However, there are reasons to believe that the opposite could be true. And that is because most of the gender wage gap, at least in the United States or in developed countries, is related to the fact that the highly paying jobs require non-standard hours, like working over the weekend, working over 5 o'clock. And that is the reason why sometimes women don't self-select themselves into these jobs. However, with the opportunity and the possibility of working from home, now this job may become more appealing to women, so they would actually apply for more frequently for these jobs. And so working from home could actually close the gap or help converging the gap. And of course, which one of the two forces is the driving one? It is difficult to say, because if you look at just at the COVID experience, it's not just working from home, it's working from home and the pandemic. And we don't know looking at the results, what is actually due only to working from home and what is due to all the other policy and programs that were passed by local governments in order to respond to the health emergency. For sure, we know that women were hit pretty hard by the pandemic. As Bill said, on 2 dimensions, they were more likely to lose their job, at least in the United States, and they were more likely to work from home. Often the decision to work from home was actually a voluntary decision, because it was a response to this new need following the closure of schools and daycare. So women were really stressed out during the pandemic because of this additional responsibility of taking care of children. There is plenty of evidence that the new additional childcare responsibilities was not equally shared between men and women, but the burden fell more on women. So women had to be working from home, plus this additional responsibility, which affected their productivity and probably their performance in the work. So women were actually extremely concerned during the pandemic that the current situation was going to affect their future career path. However, with the restore of the normal life and the movement from the pandemic to an endemic situation where schools are reopened and daycare centers are now reopened. And so it is possible that the second channel, the one that predicts that the gender wage gap will converge due to the large availability of working from home jobs to women, it is a real possibility. Next slide, Bill. It's the first time I call you Bill. I usually call you Vasilios. But probably this should have come first. But why is it that the wage gap matters to start with when we talk about working from home? Well, it matters because there is actually a wage premium associated to jobs that can be performed from working from home. It's not clear if the premium is because you work from home and you're compensated for working from home with a higher premium, or because jobs that demand a higher wage, they end up being also the one more prone to working from home. But there is a wage premium, whatever the reason is behind. It's interesting how at the beginning, there was actually a wage penalty from working from home. That was probably due to the stigma of working from home. But as time went by and working from home became more accepted, then the penalty became a premium. Given that we know there is a premium associated from working from home, what was the impact of inequality, not just gender inequality, but general inequality in during the pandemic? There is a pretty strong consensus across country and across this, research design that inequality increased during the pandemic. So it's not clear if gender inequality increased during the pandemic or will, continue past the pandemic. But there is a pretty strong evidence that the general income inequality increased during the pandemic, both using the Gini coefficient measure or some poverty index. And that was true in Europe, it's true in the United States, it's also true in Latin America, for example. Of course, this is, I would say, at the moment preliminary. I'm expecting a lot of more research to come now because usually income data comes with a lag of 1, sometimes 2 years. So the income, the information about income from 2020 is about to come available to researchers. So I'm assuming there's going to be a lot of new research on this topic, but I also expect that the result will be similar to the preliminary one that which pointed to an increase in inequality. An interesting point is that although people in the lower quartile of the distribution or quintile, depending on the research design, were more likely to lose a job, for those people, actually, the sheltering effect of working from home was actually larger than for the upper individuals in the upper side of the distribution, which means that people in the lower portion of the income distribution were less likely to be able to work from home. But if you were working from home, really saved you from incurring some big financial losses, even larger than for people in the upper side of the income distribution. And next. What was the impact of working from home on productivity? It's here we have two lines of research. We have the pre-pandemic research line of research, which is very limited. It's basically one paper, Bloom et al., which points to actually very large level of increase in worker productivity when workers are allowed to work from home. During the pandemic, the preliminary evidence is that productivity suffered a bit. Of course, it's not clear.
I'm sorry, Francesco. 2 minutes left. Sorry for that.
Say it again?
2 minutes left.
Okay, sorry, perfect. This is the second to last. It's not clear if that's due because of working from home or because of the pandemic itself, with the distress of having children running around the house while you're trying to do your work. So for sure, women suffered in terms of productivity during the pandemic. And one of the reasons of concerns about working from home and productivity is not so much the stigma that we had before of workers shirking during their working from home time, but is the decrease of interaction between team members, especially in tasks that require cooperation between a team. And that's as we're going to see in the next slide is actually a pretty important component, because this decrease in teamwork or the interaction on teamwork had not only an impact, a negative impact on productivity, but also increased and in a decrease in the well-being of the workers, because workers are feeling a little bit more isolated when they're working from home, which is affecting their mental well-being. There are, although this is not to say that working from home will have only negative effect on workers' well-being. There is actually evidence that for some workers, actually working from home improves their well-being, and mostly because it helps to balance their life-work activities. The decrease in commuting time and the stress from commuting has definitely some positive impact on mental well-being. But it's not only about mental health, it's about also physical health, and the issue of working from home that may come up in the future years is the fact that often office spaces at home are not ergonomically correct. And so some workers have actually experienced an increase in musculoskeletal problems due to the fact that often they were working on kitchen counters or a space that was not designated specifically for work, and so they did not have the appropriate technology or even the basic like comfortable chairs and ergonomic mice. So in conclusion, what is likely to happen? There are some advantages of working from home. There's definitely some disadvantages of working from home. Working from home is here to stay, but in which shape? Well, most likely we think that it's going to be more like in a hybrid form. So, and that seems to be the preference of many workers, where some of them are missing going to work, but they are not missing going every day to work. So probably, at least what is happening in the United States, looking at big corporations such as Google and Amazon and Apple, what is likely to happen is that there's going to be a lot of flex time where workers are going to go on the workplace but they're going to do some work also at home as well. That's going to change definitely the idea and the functionality of the workplace. The workplace is not going to be the place where the work actually takes place, but the workplace will actually be the place where new ideas get generated during this brainstorming, where the team actually gets together to come up with a new project, which will be carried out maybe at home. This is going to change also the way we build office spaces, and architectural firms are already rethinking about, okay, how do we actually design a place for this future way of working. But as a reminder, one thing that we should also keep in mind is the mental and health cost of working from home, as well as possible changes of the distribution of workers, because now you don't have to work anymore. You don't have to live nearby work. You can live in another city. So there will be actually some major redistribution of workers across the territory. And that's the end of my section.
Thank you very much, Francesco and Bill. Do you have any comments?
I'm intrigued by Germany. I wonder if it could be related to the Hertz reform, the fact that before COVID, because while you were talking, I was scrolling the data. It looks like it's from 2005 that before that, from 1982, there was a tendency towards increasing working from home. Then it started going down from 2005 until COVID. And I'm struck by the coincidence with Hertz reform into the, coming into effect in 2004. But just curious.
It's very interesting to me. The countries you would have expected. What would your priors have been? And then looking at the actual data. To me, there is also. I mean, really, I do think there are very big differences in culture. Right, in terms of, the relative importance placed on social interaction across, I mean, obviously, Italy, Greece, where my family's from, right? countries with very high social interaction, you know, in others. I think very interesting, very timely, the Wall Street Journal has a new podcast series called The Way We Work, and it is all about changing arrangements. And very timely, on Sunday, I was listening to the recent issue. One of the things they were discussing with a woman who is a CEO or a VP at a company that's had remote work since their inception. In listening to that podcast, one of the things that it reminded me, she's talking about how well it works for them, but they were doing remote work at a time when it was rare. And in a lot of the evidence, when we look especially at productivity and the impacts and how workers, what they prefer, is based on a time when it was the you know, not the rule, but the exception. And I wonder if we, you know, I hope we're cautious in extrapolating too far from those experiences because of the scalability issue. When you're the only company or one of the few that does remote work, you can have a big selection issue. The workers who want to work remotely and who have a comparative advantage at working remotely and who are good at it can select into your firm. You know, when you try to scale that up and have a large fraction of it, now we have workers for individuals for whom it doesn't work as well. And never mind the fact that we're moving into occupations and industries which structurally aren't set up as well for it. So I do think moving forward, it's going to be interesting to see how this plays out in terms of what type of business do you have. You know, even regionally, you know, people forget sometimes even here, the United States is very large. And regionally, we have a lot of variation, not to the extent that Europe has culturally, but we do have a lot of variation here as well. So it'd be interesting to see how regionally that plays out as well.
And I see a question on the chat.
Sorry, Francesco.
Yeah.
Francesco, I'm sorry. I need to interrupt you because we are very late. Sorry for that. Ilaria, please.
Okay. Yes. I share my screen. Yes. Thank you. Thank you also for inviting me. And I'm presenting a paper written together with a few colleagues, Mina Di Marino from Norway, Ignasi Capdevila that is attending. I saw him in the people. And from Paris Business School, and Mina Akhavan, a colleague of mine from Politecnico Milan. So this presentation is very much related to the one that Francesco and Billy did, and also partially also to the first one, because it's about co-working spaces. Co-working spaces that are, we will see briefly, the third place where to work. So the first place is the home, the second place is the office, and the third place is, for instance, a co-working space. So I will say about the renewed interest of co-working spaces, especially during the pandemic. So I'm researching about working spaces, remote workers, and so on in two European projects. One is cost action, and the other is Correlite and Marie Curie together also with the Ignasi. We will tell you about the effects of the COVID-19 pandemic on co-working spaces in 4 countries, France, Italy, Norway, and Spain. So what is a co-working space? As I said, is one of the typologies of third places. Nowadays, we are also talking about fourth places. That is a combination of co-working, co-living, and in fourth places, a key role is played by the digitalization. The first co-working space was born in 2005 in San Francisco, and there has been a huge increase of these, I will show you later, of these spaces since then. A co-working space is an office, is a shared office where people can share, of course, the space and also exploit the proximities, not only the geographical proximity, but also the social proximity, institutional proximity, cognitive proximity, organizational proximity. Who are the co-workers, who are the users are mainly freelancers, but also entrepreneurs, small firms, and employees. They are mainly working in the creative and cultural industry. The value added of a co-working space is that is based on a community, a sense of community that help in sharing ideas, knowledge spillover, having new business opportunities. I will go fast. These are the literature about co-working spaces, and you can see here that there has been an increase of co-working spaces till the beginning, 2005, as I said, and an increase worldwide also of co-workers. And what is interesting, what we have experienced during the COVID-19 pandemic, is that the users of co-working spaces became more and more the remote workers, so the teleworkers. So what you were saying about the problem of feeling alone, of having troubles in working at home because of the children that were doing teaching online, and the fact that not everybody has a large house where can work and do also the other everyday activities, can be all these problems can be partially solved if you move to work in a co-working space. So during the COVID, as also the other presenters said before me, we had experienced social scaring. So this has influenced the choice of where to live and work, but also travel and commute. We also had what is called the retail apocalypse provoked by online shopping. Therefore, there has been a change, a need for a change for the working environment. Indeed, office spaces were not able to guarantee the social distancing. And what happened also, if we think about the big, the big tech, as also the others suggested to their employees to not to go back to the office. But we had also some other trends, like for instance, the fact that the work moved closer to the workers. So for instance, in Milan, these skyscrapers were not used during the pandemic, and some companies opened new premises in less central areas to host the workers. So a new geography of work, a new interest towards suburban and peripheral areas, and a renewed interest for new working spaces in order to reduce commuting, improve work-life balance, also with positive effects on the sustainability. These are some graphs, but I can show, for instance, this one about, and I very much agree with Francesco and Sergio, their paper, and Billy, that it depends the data that you look at. So if we look at this graph of Eurofund, we see that Italy was in the one of the last positions in terms of teleworking before the COVID, but we were so good that we could make an escalation closer to North European countries. As also the others said, that there is a strong correlation between teleworking and the knowledge-intensive services, and also knowledge workers, but also the size of the firm. That's why we're very low in that graph, because we know that in Italy specifically firms are small and very small. Therefore, it's not so managers and family firms are not so willing to allow their employees to telework. But the co-working space can have positive effects on the co-workers because of cost saving, of course, because you don't rent an office, but you rent a desk, on reducing the risk of isolation, boost business collaboration, promote innovation, productivity, and job satisfaction, well-being. This is also for remote workers, that when they became users, because at home, as you also said, we're not able to use adequate technology. So there was the need to reduce the risk of isolation, feeling to be always connected, work efficiency, well-being, and so on. So what's happened to the co-working spaces also during the pandemic? They also had to close down. 20%. This is a survey about worldwide about co-working spaces. There was a cancellation of events that is one of the main earnings of the co-working space, so to organize events also for the community and so on, and the cancellation of meetings and also co-working members decided to work from home and shifted to online services. So it was very important to keep the community still alive but online. Now we look briefly to the three countries. If I have to speed up, I go to the slide about the comparison. Sergio, tell me. Do you prefer?
Yes, please. Yes,
okay.
Please.
So we look at these four countries, and we look at the number of co-working spaces in these countries, where we see that, well, first of all, co-working is a urban phenomenon. So the first in Italy, for instance, we have up to now 750 co-working space. We have 119 in Milan. But during the pandemic, what's happened is that they open up also in less central areas, also to answer to a demand of remote workers and also digital nomads. We don't have so many digital nomads, but we are really attracting them now because, I mean, Italy also is a nice place and pleasant where to live. And then there is also in Italy, for instance, the issue of south working that has previously stated. So remote working before and during the pandemic. So we have Italy and Spain with a low percentage of people working remotely before the pandemic, but it became very high. While in France and Norway, it was people used to work remotely. So, I mean, yeah, they had an increase, but not so much. Indeed, in France, in Norway, for instance, people work in co-working spaces in public libraries, for instance, in order to avoid commuting every day and creating negative externalities for congestion, pollution. Is not that everybody has to work in Oslo. Why? They will go to Oslo once and twice a week, and they will keep on working in the public library in their village, hosting co-working spaces. In all these four cases, the co-working spaces attracted the remote workers, and there was a renewed, as I said, attractiveness of peripheral rural areas. And in the four countries, there has been a different answer from the government. So in Norway, for instance, and in France, there have been specific subsidies to for co-working spaces, while in Italy and Spain, very low, and the new co-working spaces in rural and peripheral areas specifically have been slightly funded. So we can say that the pandemic underlined an increased attractiveness of peripheral areas towards remote workers and digital nomads, and this created a new demand for co-working spaces. And what is interesting to analyze, and we are doing that, since big cities like Milan, for instance, more than Paris, for example, have experienced an exit of people, of users of the city during the pandemic, it's interesting to understand how long this remote working will be kept, because if people will be able to go back to the big city only twice a week, then it will happen that the hinterland of more prosperous areas will be larger. And this is what Philip McCann says, no? And this will produce a shadow effect on the economically weaker cities that will become more vulnerable, because if I can go to the big city once a week, why should I have to live in Milan that is very expensive, the houses are very small, and so on and so forth. So this is an issue to study, to understand the impact on at the territorial level, on geographical scale. But then we know that especially for knowledge workers, space matters and face-to-face interaction are important. So hopefully there will be a balance, no? A balance between the city, the center, and the peripheral areas, and then also the impact on the work-life balance, and that will be able, for instance, to reduce the overcare work for women. Okay, thank you very much.
Thank you very much, Ilaria. Thank you for your very nice presentation. Unfortunately, we do not have time for a discussion. Maybe later. Leonardo, would you?
Yes, okay. Thank you very much, Sergio. I'm going to present.
Thank you.
Okay. My topic concerns the relationship between COVID-19 and the environment. Soon after the outburst of the first wave, we were very much concerned and curious about why there was such a big effect in the Pianura Padana or in some area in China, like Wuhan, and not in other area. So the wide heterogeneity of the effect of COVID-19. And we started working also on an hypothesis of correlation between COVID and the environment. Basically, just the first month after we issued the first draft in April, and after time we improved the paper, and then we published, and we saw all the literature around, and that's why this led to this chapter of review of the literature, of course. What the first thing to say is that we didn't discover anything exceptional from the medical point of view. In medicine, it is well known. This is a very famous survey, surveying more than 200 papers in medicine, showing that exposure to particulate matter, to air pollution, is the second leading cause of death around the world. Basically, it affects negatively the heart, lungs. And what matters, it creates also cancer, but what matters for us is lungs. Basically, long-term exposure to pollution weakens lung and alveoli, and these make them, of course, less resistant to pulmonary diseases. And of course, COVID is a pulmonary disease, so basically there is nothing particularly new. Of course, you have to test whether the correlation is causation and whether this is not spurious. But basically, we have a lot of paper showing this correlation between air pollution and pulmonary diseases before COVID-19, of course. And what caught our attention is also that two of these papers were based on analysis in Wuhan and Milan. Okay, this was in 2012 and 2015. So Milan and Wuhan were considered even before as area particularly exposed to the problem of air pollution, and a significant correlation between it and adverse effects on lung function were found well before COVID-19. After the onset of COVID, a lot of paper came out. Of course, as you know, at the beginning in this time, lots of paper came out without referee reports, so that is also a big issue about that. No? So you have to evaluate the relevance of this paper. This is a paper about Northern Italy, okay, Conticini et al. On environmental pollution. There are papers in Germany, and it's a paper of Isfording and Pestel showing one standard deviation increase in PM10 particulate matter, the largest one, affect confirmed cases, especially on older patients. There are papers about China, effects in China. And there is an interesting paper about U.S. working on US regions, showing that an increase in 1 microgram per cubic meter in PM2.5 is associated with 8% increase in COVID-19 deaths after controlling for a lot of other factors. Our work, which was recently published on Ecological Economics and Journal of Environmental Management, especially looks at the effect of air pollution and also at the effect of lockdown and the effect of lockdown on air pollution, which is, by the way, quite not so intuitive as we can imagine. Of course, the methodological challenges are reverse causality. So the relationship between the two, bidirectional causation, omitted variables. Several omitted variables may affect the correlation that we examine. The third omitted factors, for example, that we have to control for the level of community, for a lot of heterogeneity at council level. We have data about province, council, and so we will consider that. Also, a very important issue is the dependent variable. It is very, very difficult to define the dependent variable because the procedure to count deaths, COVID deaths, vary across regions, and lots of people, you know, that it's very difficult to define whether some people died with COVID or because of COVID. Okay, so it's a very, very difficult definition. Okay. Because of course there are a lot of comorbidities, no, and some people just seems to die because of that morbidity, but they also have COVID, or the COVID aggravated the situation. So this is very difficult. So that's why many papers, as our paper, decided to work on excess deaths. We look at the difference of deaths between that day and the previous 5-year moving average in the same in the same municipality. Of course, excess death has other problems because there are also something that has been affected by COVID but is not related to the COVID disease, like not so a car accident or whatever. So you have to balance the different approaches. Of course, there is a big issue of spatial correlation because contagion is spatially correlated. So many papers use spatial econometric models, and we use as well. And you have to control for time varying common factors using techniques. Of course, we cannot use a randomized control trial because the event has already occurred. And we try to control for many factors and many other papers. Mobility is one of the most important issues. And we look for instruments, the literature looks for instruments. I think the nicest instruments are looking at daily rainfalls. So you look for relevant and valid instruments. Instruments can affect air pollution. Of course, they have to be relevant, but they also have to be valid. So exclusion restriction must apply. A very nice instrument is changes in wind direction. Changes in wind direction, of course, is strongly affecting pollution, but it's quite difficult to say that a change in wind direction can affect deaths, you know, directly COVID deaths or COVID cases. So we also make some synthetic studies controlling the role of lockdown and environment. And these overall, many research show that about lockdown, that lockdown measures were effective in reducing the outcome. But paradoxically, lockdown did not produce immediately a decrease in air pollution. The issue is people stayed much more at home. And in the first months of March in Italy, still eating at home was open, was working. And we have a paper with the discontinuity design because we exploited the fact that in Italy, official eating is different across the region. In the north, it lasts more, in the south, it lasts less. So we use this discontinuity, and we show that paradoxically, you see the first red line is the lockdown. The second line is the end of heating, the official eating, and you see that at the beginning of the lockdown, actually air pollution went up because people stayed down more. It was already still cold. People used lots more heating, and there was an increase of why? Because you have to remember that between 50 and 60% of air pollution is caused by heating system. We still use a lot of gas heating, and basically gas boiler are a big problem. Okay. And that's one point. So what is our conclusion? Definitely, we find that air pollution is strongly correlated with contagion and deaths. Many of the paper we considered find a causality effect, of course, with instrumental variable, not to randomized trials. The methodology they use, they are quite robust. And of course, this as a policy advice. The policy issue is very interesting. You know, I make this example because a lot of people say, okay, you have not proved 100%. I don't believe in your instrument, so I don't believe 100% that there is causality. But my question is, if they tell you that the food is poisoned at 90%, would you eat it? So what is the policy consequence that you take? Of course, you take a policy advice even when you're not 90% convinced, no? Because there is precautionary rules. So basically, you have to take policy advice. This is the same things that they said about smoking, no? About the smoking and cancer. That was exactly the same debate. So our straightforward policy advice is let us move to heat pumps. Heat pumps is exactly what the International Economic Association is asking us for ecological transition. They want us to move in 2045 to 50% of heating demand met by heat pumps around the world. So heat pumps have a very nice property. They don't create emissions and they don't create particulate matter. So basically, they are quite well advised for. So this, you know, from this paper, we started also a policy campaign in Italy saying that 100% retrofit subsidy for house retrofit should not include gas boilers, but only heat pumps. So basically, this is, you know, the synthesis of our presentation. Thank you.
Thank you very much, Leonardo, for your excellent presentation. That's a really crucial topic connected with the COVID-19. Is there any comments? Or maybe we can go to the last presentation. Thank you very much. Thank you so much. Mauro, would you like to?
Yeah, thanks.
Yeah. Thank you
All right.
so much.
All right. Can you? No, hang on a second. Sorry. Here you go. Okay. I guess can you see it?
Yes.
Yeah. Perfect. Okay. Thank you very much. Thanks for joining. So this is joint work with Andrea Fracasso, and we're both at the University of Trento, and it's on the connections between COVID-19 and technology. And so, I mean, as we know, clearly COVID-19 caused all kinds of chaos around society and economy. And one of the big things used by authorities, companies, and individuals in order to cope with the challenges caused by COVID-19 was indeed the technology available. And some of my colleagues' works already mentioned these. And for instance, working from home is very much related to this, as we will see. So besides the available technology, a lot of new efforts, R&D efforts, have been directed towards development of new technologies for new solutions and applications to solve the challenges caused by COVID-19. So in this sense, a vast scientific literature, which actually cuts across very wide disciplines, and various disciplines that address the questions of how technological advancements could help to alleviate the issues related to COVID-19 pandemic and also potential future transmissible diseases. So this chapter reviews this international interdisciplinary literature, and we divide it up into two main parts. The first part is very much connected to all the health technologies that try to identify infected individuals, prevent contagions, also model and predict the evolution of the disease, and finally, in order to enhance and treat, enhance the treatment and the medication of patients or infected individuals. So that's the first part. The second part is, on the other hand, related to the technological solutions applied in the workplace. which may be partly in the health sector itself, so related to the partly related to the first part of the chapter, and then also in non-health related sector. And in particular, what we focus on is on technologies, basically on how technologies have mediated the impact of the pandemic on labor and other business outcomes, and also on the governance of supply chains. So let me briefly discuss the so-called health technologies. I mean, we know that the early detection and diagnosis of transmissible disease is of utmost importance. And so clearly a big part of the literature has been about the prevention, detection, and monitoring of infected individuals. So I'm not going to go through all the papers. So the second part of it that is very much important is about the modeling of the spread of the disease, and also in order also to predict how it would spread, and therefore to keep a check for surveillance, right, of how it would spread. Of course, all of these requires a lot of data. And so the quality of information is what I want to stress for this part of the literature. The quality of information that is fundamental in order to understand the evolution, and also in order to comply, right, to determine rules that are important for compliance and self-restraint. The third part of this chapter was about treatment, and so all the technologies important for treatment. And here I want to stress, in particular, I think telemedicine and telehealth, which have been used a lot in order to deal with COVID-19, in order to reduce also the risk of infection in hospitals. Right? So there are, of course, issues related to all these technologies applied in the health sector. I mean, in simple terms, for instance, we can think of the effectiveness of contact tracing tools that have been questioned for several reasons. But the main issue is really about the infringement of fundamental rights, privacy, and data protection due to connected to the collection and storage of data. We know that there's been potential abuses of the more aggressive types of tools used for contact tracing, and in particular in several countries where there have been concerns about violation of rights and stigmatization of particular ethnic and socioeconomic groups. So here there is therefore a trade-off between, if you will, the efficiency of these data-driven or these modern surveillance systems, and the potential abuses, incorrect uses and abuses of the sensitive information that is required for such systems. And of course, this trade-off, this clash, if you will, depends on the times that we are at. So emergency times as COVID-19 pandemic versus so-called normal times. The second part of the chapter has been about the technological solutions in the workplace. And of course, I mean, the idea here is that in order to tackle the diffusion of COVID-19, businesses, but also public institutions had to intervene in order to mitigate the adverse effects of the virus on employees, customers, clients, buyers, suppliers. So in a simple way, there's been incentives for working from home, as we've seen. And so also employers have given up these incentives, have given such incentives. There's been screening of individuals in order to access certain places. There's been automation of tasks. And all of these clearly have required new technologies. Now, these technologies have clearly played a key role in transforming workplaces, human resource management, production, sales networks. And all of these transformation is obviously costly, but potentially is the rational response of firms and more generally also say of individuals in order to reduce the so-called shadow cost on labor requiring proximity usually, right, in more normal times. So the chapter here is, the section of this chapter is divided into two. The first part is more related to the technologies more specific for the healthcare facilities. And here again, we discuss telemedicine and telehealth, but also now we discuss robots and robotization also in the health sector, and how it's being used in order to reduce the risk of contagion in the workplace, and for instance, chatbots as well. Beyond that, we really focus more on the issues related to personal distancing in the workplace, especially in workplaces not related to the health sector. And here we see several technologies that have been developed. For instance, we saw before the issues related to vaccination, and indeed vaccination certificates and passports have been used a lot, especially in more recent times after vaccines have been available. And of course, however, there are potential risks related to the use of these new technologies with vaccines. So these may seem to be to limit their use in the future, especially in some countries. Other technologies that have been incentivized a lot, I guess, is all of those technologies that have facilitated work from home practices, and also e-commerce, as they can sustain production and consumption even from remotely. Now, we in this chapter clearly we don't focus on the potential transformation of the organizational work in companies, as that's what the previous work that we saw is more related to. We really just focus on the technological and technology related issues that are connected with work from home and personal distancing, and how these technologies in a sense impact on labor and business practices. So one bit of data I want to show you is this work from Bloom and co-authors, where they show how the type of new R&D efforts that have been put in order to take advantage of the opportunities of working from home. And so here we show how patents directly related to work from home have boomed clearly following, from February 2020 onwards, following the pandemic. In another work of mine, with also with Andrea Fracasso and Silvio Traverso, we rather focus on robotization, which is yet one of the so-called new technologies, right, that are very much in everyone's mind, and we focus on particularly we focus on how robotization is potentially associated with the risk of workplace contagion, and we look at data for Italy in order to understand this issue. So one of the things we do is that we exploit a measure of risk of workplace contagion, which was constructed by an Italian public agency, INAPP, which works specifically on, indeed, on insurance of accidents at work. And we combine these with data on robot use by industry. Now, the idea here is that basically we want to study the cross-industry relationship between the estimated risk of contagion at work and the adoption of robots, with the hypothesis that robotization can facilitate social distancing in the workplace and thus lower the risk of contagion. Now, indeed, we find that in industries employing more robots per worker in production, these tend to exhibit a lower risk of contagion due to COVID-19, even after taking into account potential endogeneity issues and and therefore using an instrumental variable approach. We also find that the negative effect is stronger in so-called traditional industries. That is where the potential substitution between labor and robotization and robots is potentially stronger, and where remote work is not possible. Now, one of the things that we should keep in mind, however, is that it seems that robotization and labor may be kind of substitutable. Well, definitely substitutable, but we should keep in mind that this is not necessarily the case. And indeed, in the paper, we discuss also the issues related to labor substitution or not, and the potential issues for society of these. But we need to keep in mind that the interaction, as right here, of robots and workers does not necessarily need to be labor saving. I mean, we can think in very simple terms, for instance, of cobots, right? Collaboration robots, where indeed you need a worker in order to work, in order to make the robot work. There is, besides robots, we can think about other technologies that are important or have been deployed extensively in order to keep this social distancing. Work of Sergio Scicchitano with his co-author, with Carbonero, they focus on AI, and they find that occupations and sectors characterized by
una conferenza, così parliamo
can hear someone. So occupations and sectors characterized by the potential exposure to AI tend to need less physical proximity among workers. So kind of in line with the previous work. Other technologies have been developed extensively also in this sense. So high-speed internet, there's been diffusion of online and mobile banking, IT, and all of these kind of tell us that digital infrastructures and personal training is fundamental for business continuity in difficult times like COVID-19 pandemic. Now, there are, of course, issues with all these new technologies being deployed in the workplace. And for instance, AI may be too narrow, it may need to match data. The diffusion of digital technologies and work from home practices can lead to uneven economic and social outcomes. There are issues with work from home and productivity, as it was reviewed before, and potential increase in communication costs. But perhaps like most of the work is kind of focused more generally on the idea that technologies like robotization, like robots and AI, can do not just economic harms, but also social and political harms. So one hand, we can see the work by Acemoglu that focuses on this damage to competition, consumer privacy, consumer choice, but also some other work that I did previously with Andrea Fracasso and Silvio Traverso, where we look at the effects of robotization on political outcomes in Italy. So the potential harm to political discourse and political outcomes. So we conclude the chapter looking at the supply chains, and we know that one of the issues really is about COVID-19 is about building more resilient supply chains. But the potential technological solutions in order to do so are unclear, at least in the literature, in the sense that some observers, some works kind of push for this idea of reshoring and nearshoring in combination with robotization and additive manufacturing. Of course, these with potential risk for technological unemployment are considered in this literature. But other works focus more on different supply chain.
I'm sorry, Mauro, can I ask you to conclude your...
Yeah, I'm coming to the conclusions indeed. Yeah. And so different potential technologies in order to make supply chains more resilient. So just to conclude, so what we did was to review these rich interdisciplinary literature, and we focus our work a lot on the review of the technologies that have been available and the effects of these technologies, especially in the workplace. Okay. There are some key points that I think we want to stress on this, and I will conclude with that, is that first of all, technologies are fungible. They can be used for many purposes and other purposes than what they were intended for, and so they can have unexpected consequences, and this can create uncertainty. New technologies also offer a large number of opportunities to recover faster and in a more inclusive way, but they pose risks. So, I mean, I mentioned the risk of fungibility before, but also privacy is a huge risk, and long-run changes in labor markets. So, besides uncertainty and risks, there are, I mean, connected to these uncertainty and risks, we can see a backlash, potential backlash against new technologies, especially if they are deployed too fast. And then last, I think I want to finish with this potential avenue for future research, is that we see that there is a bit of lack of real-time data on new technologies available, you know, in real time. And so a lot of these works have been reviewed as single application, really. And the only exception is really is about the works on patents. So I guess that developing works on patents are potentially very interesting in this kind of field. And I will conclude with that. Thank you very much.
Thank you. Thank you very much, Mauro, for your excellent presentation. I think we have a comment by Marcella, if I well understand.
Yes, if I have time, of course, because I realize it's very late.
Yes,
I have just a minor question to Mauro. Maybe I will write more about that to him directly. In this huge review of the literature on COVID and technology, did you come about studies connected to technologies for care? Because since, as I stressed since the beginning, the pandemic has brought to the attention of a huge audience the issue of care, and even we were talking about the care revolution due to the pandemic. Technology can play a huge role also in that direction, especially for the care of the elderly, for example. So I wonder whether in your review you came about this type of literature. I would be extremely interested in knowing about it.
Yeah, definitely. I mean, yeah, thanks for your question. Yeah, definitely. There's been a part of this has been about care in the sense of treatment, but more related. I have to say, like more related to COVID. So the treatment of COVID. But potentially, I mean, some of the technological solutions that have been deployed for the treatment of COVID, you know, can be also deployed for treatment of other diseases. And so there is definitely like quite a lot of work on this, I would say. Like, so all the part on the health sector and all of that also tries to review that issue. So, but yeah, that's definitely important. And I mean, for instance, robots and cobots are part of it.
Yeah, I was also thinking about domotics, for example. So the use of technology for carrying out homeworks for the children, like for the housewives and so on. So technology for the everyday use, I would say so. But anyway, we will talk about that. I will write to you about that. Thank you.
Yeah, that'd be great. That'd be great. Thanks.
Thank you very much. Thank you to all of you for your excellent presentation. We explore, let's say, crucial topics associated with the COVID-19. I'm sorry we were a bit late. I'm sure all of your chapter will receive a huge number of downloads and citations. And I'm looking forward to read all of the other chapters in the handbook. Klaus, would you like to conclude?
Well, yes, maybe a few seconds. It was a very impressive session. I think the whole section is developing very well, and I've already seen some of the chapters which are on the way to production. As you know, everything what is done is immediately, well, as soon as possible, as the publisher is doing it, is going to be online. This means it can be downloaded, cited, and distributed. And well, events like this are not only important to improve what we have, but also help to improve also chapters which are already done, perhaps, because as you may not have noticed, all the online versions of the handbook are there and can be changed sometime in the future again and again if an update is necessary. And this is particularly important for this topic, the COVID-19 topic, where we will still see, of course, lots of interesting additional knowledge. Well, thanks again for all your efforts. It was, as I say, very impressive. I see that we are in good shape. Thanks.
Thank you.
Thank you.
Thank you. Thank you.
Bye-bye.
Bye-bye.
Bye, everyone.
Thank you. Bye. Bye.
Bye.